Have you ever wondered if there's a right amount of self-pleasure for men over 60? Picture this: one recent survey found that 65% of men in their 60s report changes in libido and sexual function, yet few discuss how often enough really is. I'm Dr. Henry Carter, a urologist with more than 3 decades of experience helping men revitalize their sexual health naturally. Today we're diving into the science and the secrets behind masturbation frequency after 60. In the next few minutes, you'll discover why the number of times you stimulate yourself matters more than you might think, how to pinpoint your own personal sweet spot, and what happens to your body when you go too hard or not hard enough. We'll cover the surprising physical and mental benefits of maintaining a regular routine, the warning signs that you might be overdoing it, and practical guidelines backed by the latest urology research. Whether you're single in a long-term relationship or somewhere in between, understanding healthy masturbation frequency can help you maintain better circulation, improve your mood, and even protect your prostate health. We'll also tackle the common concerns and myths that leave many men feeling guilty or confused. By the end of this video, you'll have clear, actionable insights you can tailor to your lifestyle and health needs without judgment, without gimmicks, and without complicated treatments. So sit back, relax, and let's reset what normal means for your sexual wellness after 60. Your body, your confidence, and your doctor-approved game plan are about to get a powerful boost. Meet your urologist, Dr. Henry Carter. I'm Dr. Henry Carter, and for more than 30 years, I've dedicated my career to men's urological health, specializing in the unique challenges that come with aging. After completing my residency in urology at the University of California, I went on to serve as Chief of Men's Health at Riverside Medical Center, where I've helped thousands of patients navigate everything from erectile difficulties to prostate concerns. Over the decades, I've seen firsthand how a straightforward habit, masturbation, can be a powerful tool for maintaining sexual function, yet it's something too often shrouded in misinformation or embarrassment. My goal is simple: to arm you with clear, research-backed guidance so you can take control of your sexual wellness without feeling awkward or isolated. Beyond the clinic walls, I've published peer-reviewed studies on aging and libido, spoken at international urology conferences, and counseled men from all walks of life, from busy executives in their 60s to retirees rediscovering intimacy. I've learned that no two bodies age in exactly the same way, which is why a personalized approach to self-pleasure frequency can make all the difference. In this video, you'll benefit from the insight I've gained, both in medical practice and in academic research. You'll hear the latest findings on how often self-stimulation can support healthy blood flow, hormone balance, and prostate protection, as well as the warning signs to watch for if you're pushing too far. So whether you're curious, cautious, or somewhere in between, rest assured you're in expert hands. Let's explore how simple adjustments to your routine can lead to better night's sleep, improved confidence, and a stronger, healthier you starting right now. How aging changes your sexual response. As we age, our bodies undergo natural shifts that can influence how we experience arousal and orgasm. Starting around our mid-50s, testosterone levels gradually decline about 1 to 2% per year, and that hormonal dip can affect both libido and the firmness of erections. You might notice it takes a little longer to get in the mood, and once you're there, maintaining rigidity can feel trickier than in your younger years. On the physical side, blood vessels become less elastic over time. That means circulation to the penile tissues isn't as robust, and the mechanism that traps blood inside the shaft can lose some of its efficiency. It's not just about performance, it's about how your body literally responds to stimulation. At the same time, muscle mass and pelvic floor strength can diminish, which also plays a role in the intensity of sensations and the control you have during climax. You may find you need more direct stimulation, or that different positions and techniques feel better than those you used at 30 or 40. Mentally and emotionally, it's common to feel a dip in confidence when you notice these changes. Yet understanding that they're a normal part of aging can take the pressure off. Instead of seeing every delay or softness as a failure, you can recognize them as cues to adjust your approach, whether that's pacing yourself differently, using lubrication, or tuning into what feels best right now. In this section, we'll break down exactly what happens inside your body and why tuning into these changes is the first step toward finding the healthiest, most satisfying rhythm for your self-pleasure routine after 60. The science of masturbation: what happens in your body. When you engage in self-stimulation, a remarkable cascade of physiological events unfolds, many of which work in your favor, especially as you navigate life after 60. It all begins in your brain, where the anticipation of pleasure triggers the release of dopamine, the neurotransmitter that primes your reward system. That initial rush not only heightens arousal, but also reinforces the habit, wiring your mind to seek out that feel-good experience again. As your heart rate climbs, blood vessels throughout your body, including those leading to your pelvic region, dilate. This vasodilation is essential for an erection. Nitric oxide is produced in the lining of your blood vessels, relaxing smooth muscle cells and allowing blood to flow into the cavernous tissues of the penis. The more often you activate this pathway, the more you're essentially giving your vascular system a low-impact workout, strengthening its responsiveness over time. At the same time, oxytocin and endorphins surge in the bloodstream, producing a sense of calm and contentment. Oxytocin, often called the love hormone, supports social bonding and reduces stress, while endorphins act as natural painkillers and mood elevators. Both are crucial for emotional well-being, helping to counteract anxiety and depression, a benefit that becomes increasingly valuable with age. Beyond the immediate pleasure, regular masturbation stimulates the pelvic floor muscles, which play a critical role in both urinary control and sexual function. Each contraction and release enhances tone and endurance, contributing to firmer, longer-lasting erections. Think of it as targeted exercise for the muscles that support your entire pelvic region. On the immune front, studies suggest that ejaculation may boost levels of immunoglobulin A, an antibody that guards against pathogens in mucosal tissues. While the research is still emerging, this potential immune support could be another piece of the health puzzle, especially during seasons when colds and flu are circulating. Finally, let's talk prostate health. Gentle, regular ejaculation helps keep the prostate duct clear of fluid buildup, potentially reducing inflammation and lowering the risk of benign prostatic hyperplasia. While masturbation isn't a guaranteed preventive measure against prostate issues, it does promote healthy fluid exchange and can be part of a broader strategy for maintaining glandular function. In essence, masturbation activates multiple systems: vascular, muscular, neurological, hormonal, and immunological, all at once. By understanding these interconnected benefits, you gain insight into why finding the right frequency doesn't just feel good in the moment. It can translate into lasting improvements in circulation, mood, and overall well-being. Top 5 health benefits for men over 60. Let's dive into the 5 biggest perks you get when you maintain a healthy self-pleasure routine in your 60s and beyond. First up, stress relief and better sleep. When you climax, your body floods with endorphins and oxytocin, those natural mood elevators and tension busters. Many of my patients tell me they fall asleep faster and wake up feeling more refreshed when they have included masturbation in their nighttime wind-down. Second, preservation of erectile tissue health. Every time you go through the full cycle arousal, erection, ejaculation, you're essentially giving your penile blood vessels and erectile tissue a workout. Think of it like flexing a muscle. Regular activation helps maintain elasticity and responsiveness, which means firmer erections and a shorter recovery period between sessions. Third, hormone balance and mood regulation. Consistent self-stimulation triggers a gentle surge of testosterone and luteinizing hormone, helping to counteract the natural age-related decline in these key players. You'll notice improved energy, sharper focus, and a more stable mood throughout the day, a welcome contrast to the fatigue and irritability that can sneak in when hormone levels dip. Fourth, prostate protection. Gentle, regular ejaculation promotes healthy fluid turnover in the prostate gland, which may lower inflammation and reduce the risk of benign prostatic hyperplasia. While it's not a standalone cure, adding masturbation to your wellness toolkit complements screenings and lifestyle measures like exercise and a balanced diet. And fifth, cognitive boost. Recent research suggests that sexual activity, and yes, that includes masturbation, stimulates neurogenesis in the hippocampus, the part of your brain responsible for memory and learning. Improved blood flow delivers more oxygen and nutrients supporting brain health and potentially sharpening your recall and mental clarity. So there you have it, 5 scientifically backed reasons why a thoughtful regular masturbation routine can be one of your best allies in healthy aging. From easing stress and protecting your prostate to boosting hormones and brain power, you're not just indulging in pleasure, you're investing in your overall well-being. Recommended frequency, finding your personal sweet spot. Now that you know the benefits, the big question becomes, how often should you indulge? Clinical guidelines vary, but the truth is, there's no one-size-fits-all prescription. Instead, think of frequency as a spectrum. On one end, too infrequent, and you may miss out on circulation, muscle tone, and hormonal boosts. On the other, excessive sessions can lead to fatigue, soreness, or even a mental downturn if it starts to feel compulsive. Most research points to a moderate range, roughly 2 to 4 times per week, as a solid baseline for healthy men over 60. This schedule allows for consistent activation of your vascular and pelvic systems without overtaxing your energy reserves. If you're in good health with no significant cardiovascular or joint issues, you might find yourself aiming for the higher end of that range. If stamina or recovery time is a concern, dialing back to 2 sessions per week still delivers meaningful benefits. To pinpoint your own sweet spot, track how you feel immediately after and in the days following each session. Are you energized, relaxed, and sleeping better? Or do you notice muscle soreness, lingering fatigue, or a dip in motivation? Use these cues as your personal feedback loop. A simple journal or notes app can help you spot patterns over time. Remember, your overall lifestyle plays a role too. If you're physically active, eating well, and managing stress effectively, you might handle more frequent sessions. On the other hand, factors like medication side effects, chronic fatigue, or cardiovascular concerns might warrant a more conservative approach. Always listen to your body first and consult your doctor if you have any underlying conditions that could influence your routine. Another tip, vary the intensity and duration. Not every session needs to push you to the brink. Incorporating gentler, shorter routines on rest days can still boost circulation without demanding full recovery. Think of it like interval training for your vascular system, periods of higher intensity, followed by lighter maintenance level activity. Ultimately, finding the right frequency comes down to balance. Too little and you lose out on key physiological benefits. Too much and you risk physical or mental burnout. By starting with 2 to 4 sessions per week, monitoring your body's response, and adjusting based on energy levels and recovery, you'll land on a personalized rhythm that supports your health and enjoyment for years to come. When more is too much, signs of overdoing. While regular self-stimulation offers a host of benefits, pushing beyond your body's limits can introduce problems. First, listen to your physical cues. Persistent soreness or chafing around the glands or shaft suggests you're not allowing enough recovery time. A bit of tenderness after a session is normal, but pain that lingers into your daily activities is a red flag. Second, note changes in energy and mood. If you feel consistently drained, foggy, or irritable in the hours or days following masturbation, that's a sign you may be exceeding your optimal frequency. Masturbation boosts hormones and endorphins, but like any workout, overtraining without proper rest can deplete your reserves both physically and psychologically. Third, pay attention to your sexual response. Are you finding it harder to achieve or maintain an erection during subsequent sessions? A temporary refractory period is expected, but if you're experiencing prolonged difficulty or decreased sensitivity, your tissues may be fatigued, and quality is being traded for quantity. Fourth, watch for intrusive thoughts or compulsive urges. Masturbation should feel liberating, not like a chore. If you catch yourself repeatedly turning to self-stimulation as the primary way to manage stress or emotional discomfort, especially at the expense of hobbies, social interactions, or sleep, it may indicate a behavioral imbalance. Fifth, consider the impact on your relationships. If masturbation starts replacing intimacy with a partner, or you feel guilt or secrecy around your habit, those emotional strains can undermine both your mental health and your connections. A healthy routine should enhance your well-being, not create conflict or shame. Lastly, check in on your pelvic floor. Overuse without adequate strengthening exercises can lead to muscle fatigue, causing urinary leakage or urgency in some men. If you notice any new urinary symptoms, dribbling frequency, or difficulty starting and stopping flow, it's time to reassess both technique and frequency. Recognizing these warning signs empowers you to adjust your routine before minor issues become persistent problems. In the next segment, we'll explore how to fine-tune your self-pleasure practice for maximum benefit without crossing the line into overindulgence. Psychological and emotional gains beyond the physical perks, a balanced masturbation routine can work wonders for your mind and mood. First, let's talk confidence. Regular self-stimulation reminds you that you still have agency over your body's response, reinforcing a positive self-image. In my practice, I've seen men who once felt defeated by performance worries regain a sense of control simply by tuning into what feels good and celebrating small victories. Next, stress and anxiety often take center stage as we juggle life's demands. Masturbation triggers the release of oxytocin and endorphins, natural mood lifters that act like a built-in anxiety antidote. You may notice that a session helps you reset, reducing tension and leaving you better equipped to handle daily challenges, whether it's family obligations or career pressures. There's also an intimate connection to mental resilience. Studies show that sexual satisfaction correlates with lower rates of depression and improved overall life satisfaction, especially in older adults. By incorporating a self-pleasure habit that feels comfortable and guilt-free, you're actively investing in emotional well-being. Finally, for those whose partners may be unavailable due to distance health issues or personal circumstances, masturbation maintains intimacy with yourself. It reminds you that sexual fulfillment isn't solely dependent on another person and can foster a healthy, independent relationship with your own body. These psychological benefits boosted confidence, stress relief, emotional uplift, and reinforced autonomy combine to support mental health in powerful ways. In our next section, we'll delve into practical tips to make every session safe, comfortable, and maximally beneficial. Practical tips for safe, comfortable masturbation. When it comes to self-pleasure, comfort and safety are just as important as frequency. First, always start with the right lubrication. As we age, natural lubrication can decrease not just for partnered sex, but for solo sessions too, so choose a high-quality, water-based lube to reduce friction and protect sensitive skin. Apply generously and reapply as needed, especially if you notice any dryness or tugging. Next, experiment with technique and pacing. Rather than jumping straight to a vigorous grip, ease in with gentle strokes to warm up the tissues and gauge sensitivity. You might find that alternating between light teasing motions and firmer pressure enhances both comfort and pleasure. Pay attention to what feels best in real time, and don't be afraid to slow down or change grip angle if anything feels sore. Timing matters too. Many men benefit from scheduling masturbation as part of a wind-down routine in the evening. The release of endorphins and oxytocin can help usher in deeper, more restorative sleep. Others prefer a morning session to jumpstart energy and mental clarity for the day ahead. Trial both and stick with what aligns best with your daily rhythm. Environment plays a role in relaxation. Choose a private, clutter-free space where you won't be interrupted and can fully focus on sensation. Soft lighting, ambient music, or even a favorite podcast can set a comfortable mood. The goal is to create a mini retreat where stress melts away and you can be fully present. Don't overlook hygiene. Wash your hands and any toys or devices before and after use with mild unscented soap to prevent irritation or infection. And if you use any novel tools, vibrators, prostate massagers, or rings, make sure they're body-safe, clean, and designed for your comfort. Finally, consider integrating pelvic floor exercises. Simple contractions, often called Kegels, can strengthen the muscles that support erection and ejaculation. Try holding a gentle clench for 5 seconds, then releasing, repeating 10 times. You can do these anytime, even discreetly seated at your desk. By combining the right lube, varied techniques, thoughtful timing, a relaxing environment, and good hygiene, along with occasional pelvic floor work, you'll maximize both pleasure and safety. In our next segment, we'll cover special considerations for men managing chronic health conditions. Special considerations for men with health conditions. For men managing chronic health issues, tailoring your self-pleasure routine is essential. If you have heart disease or high blood pressure, check with your cardiologist before increasing frequency. Any sexual activity raises heart rate and blood pressure temporarily, so it's wise to confirm what your body can handle safely. Those with diabetes should monitor blood sugar closely. Fluctuations can affect nerve sensitivity, making genital sensation either heightened or dulled. If you notice numbness or tingling, adjust your technique slower. More deliberate strokes often feel better and ensure glucose levels are stable before and after sessions. Arthritis or joint pain can make certain positions or grips uncomfortable. Experiment with different postures, lying on your side with a pillow between your legs or sitting in a supportive chair to reduce strain on your hands, wrists, or spine. You might also try lighter pressure or shorter sessions on days when pain flares up. Medications can influence libido and refractory time too. Beta blockers, antidepressants, and prostate treatments often carry sexual side effects. If you suspect a prescription is affecting your stamina or desire, discuss timing or dosage adjustments with your doctor, rather than pushing through discomfort. Finally, for men with pelvic surgeries or radiation history, scar tissue and nerve sensitivity may alter your experience. Gentle massage around the perineum with plenty of lubrication can help, but if you encounter persistent pain or unusual symptoms, seek professional evaluation. By adapting your routine to your health profile and keeping an open line with your healthcare providers, you'll maintain safety while still enjoying the benefits of a healthy, self-pleasure practice. Frequently asked questions. Let's tackle some of the questions I hear most often. Is daily masturbation okay? For most healthy men, over 60 daily sessions can be fine, provided you feel energized, not wiped out. If you're hitting that sweet spot and waking up refreshed, there's no harm in a short, gentle routine every day. Will it affect my prostate health? Regular ejaculation supports fluid turnover in the prostate, which may help reduce inflammation. It's not a guaranteed shield against prostate issues, but it's a low-risk strategy to complement screenings and a balanced lifestyle. Can it improve my erection strength? Absolutely. By keeping blood vessels elastic and pelvic muscles toned, a consistent routine trains your body to respond more robustly over time. Think of each session as a mini workout for your sexual organs. What if I feel guilty or embarrassed? You're not alone. Many men carry outdated beliefs about self-pleasure. Remember, masturbation is a natural, healthy behavior. Shifting your mindset takes practice, focus on the benefits you experience rather than any stigmas you may have internalized. How do I talk about this with my partner or doctor? Openness is key. With partners, frame it as part of your overall wellness plan, just like exercise or diet. With your doctor, be straightforward, mention any changes in frequency or discomfort so they can advise on safety with your medical history. These answers should help you navigate common concerns and make informed choices. In our final section, I'll wrap up the key takeaways and invite you to share your experiences. Conclusion. So there you have it, a research-backed roadmap to mastering your self-pleasure routine after 60. We covered how natural hormonal shifts and circulation changes affect your experience, the cascade of vascular, muscular, and neurological benefits that come with each session, and the top 5 health perks from stress relief and better sleep to prostate protection and cognitive gains. We pinpointed a practical frequency range 2 to 4 times per week as a strong starting point, then showed you how to fine-tune based on energy recovery and overall lifestyle. You learned the warning signs of overindulgence, simple tips for safer, more comfortable sessions, and special considerations for men managing chronic health conditions. Plus, we answered the most common questions that keep so many men in the dark about what's truly healthy and normal. Your body is unique, and so is your sweet spot. I encourage you to experiment mindfully. Track your sessions, note how you feel, and adjust until you discover the rhythm that leaves you energized, confident, and in control. Talk openly with your partner or healthcare provider if you have concerns. And remember that masturbation is not just a source of pleasure. It's a valuable tool for maintaining sexual function, emotional wellness, and overall health as you age. If you found this video helpful, hit subscribe for more evidence-based urology insights and drop a comment below sharing what frequency works best for you. I'm Dr. Henry Carter. Thank you for watching, and here's to a healthier, happier you.